Okay, welcome everyone to this afternoon's Brown Bag. Today we are going to have a session that is agency oriented, and we are going to be discussing IHSS MOU and operational guidelines. Hopefully this will assist counties in working with their managed care plans on the IHSS MOU and how to operationalize it once it's executed. Our learning objectives for today's session, understanding the opportunities for IHSS and other adult serving programs, and how to productively engage IHSS MOU conversations with your managed care plan. Really just wanting to jump right in since we have a limited amount of time. And so I'm going to turn it over to our wonderful presenter, Baljeet Hundal, and she will get us rolling. Thank you.
Great, thank you. Hello, everyone. I know we had a lot of folks register for this, and so I'm just going to kind of give some context to how we got to this point to allow some more folks to join. Maybe they're getting their lunch or, coming from another meeting and need some time. Anyway, so I do want to see if we have anyone here from CWDA. I didn't know if Renita or Diana were going to join us, but if they do later, then definitely ask them to share something as well. So we have been working on the IHSS MOU, as many of you know, for over a year now, and we have been listening to counties about what does the MOU with the managed care plans in your county mean for your program, for your staff, the workload, the administrative workload. And so last year we went through several steps, starting with bringing counties together to go through the MOU itself. And I know several of you are here. I see Mark from San Diego, who was part of that group. Sacramento, there were many people that helped Diana and I kind of look at the MOU from the county lens of, what are your concerns around it? What are some issues? What are some opportunities also with it? And so then we added the additional language to the MOU based on those conversations. We put out a webinar back in May about that first edition. CFPIC hosted that for us. It's on their website. And then in August, we updated that MOU based on feedback that counties were receiving from these conversations at the local level. And so that is also on the CFPIC website. Then when Renita came on with CWDA, we started to engage in the conversation around, okay, once counties do execute the MOU, then what, right? What does this mean? What are the operational items to start to think about? And as what we heard from counties was it was hard to think about executing the MOU until they really fully understood what the work around this MOU would be. And so Renita from CWDA put together a work group starting in November of last year. And I want to say we met around 4 or 5 times. Several of the counties that are represented here were part of that work group. And Renita and I went through the MOU, looked at parts of the MOU where it calls out that the MCP and the county or one or the other has to develop policies and procedures around a particular area of the MOU. And so we listened to counties around what would that look like. And so once we convened those meetings, Renita and I started to work on this. We first called it a policy and procedure. We're now starting to call it more of an operational guidelines. And so in January, we started to share a very rough draft of this with some of the counties. And what we're going to present to you today is a more finalized version of that guidelines. And it really picks up certain sections of the MOU where it was clearly written that we needed more guidance of what that would look like at the local county level. So I don't know if we have shared that in the chat already, Sharon.
I'll drop it in the chat right now.
Okay, I appreciate that. And apologies, we kind of went back and forth if we would share this ahead of time. We decided to drop it in the chat today. I am very open to getting feedback on the guideline after this. Do a review, and if you find something that you feel like we need to add more language to it, or there's an area of the MOU that we didn't include that you think we should include in the guidelines, we will definitely appreciate that feedback. I do want to call out three people in particular that really helped us from the counties in our final couple of weeks of putting this together. And so Renee from San Joaquin, Jeanette from Sacramento, and also Shannon from San Francisco. Really appreciate you guys taking time to review this document with us and giving your feedback, comments, and edits that were needed. We also were able to review it with a health plan that has helped us tremendously through our CalAIM work around the MOUs, and that was Partnership Health. So they did a very quick review initially. I'm still waiting for more of a review because they were going to share it with their coordination team, which they said was the team that would probably work more with the IHSS program. So I'm going to bring it up on my screen right now. You should have it in the chat, I believe, or it will be posted here shortly. I'm just going to go through it, give time as we go through each section for folks to ask questions. If you could raise your hand, that would be appreciated. Or if you want to add your question to the chat, that's great. We will monitor those as well. And then I did see that Diana from CWDA has just joined us. Thank you, Diana. If there's anything that you want to add, I just kind of gave a context to how we got here.
Nothing to add. Sorry to be late from another meeting, and thank you.
Right, thanks. All right, so let me get it up on my screen. So, so this should be dropped into your chat now. And just to share, so this is a guidelines that could be would maybe need to add more at the local level based on your local policies and procedures and practices. And so we kind of looked at this from a global statewide lens and recognizing that you may do things that are unique to your county, and that's where you would add additional information if you decide to adopt this. These can be converted into a county policy and procedure as well, if you would prefer that this be called policies and procedures. And like Sharon said in her opening statements, this could help guide some of that conversation that you're having with the managed care plan and how you see the MOU being operationalized, and are they in alignment with that? Or maybe they would also give you suggestions on how they would see it being operationalized. And so again, it's going to add to the conversation that you or your staff are already having with your managed care plans. So we have table of contents, and again, the overview is just a real quick overview of CalAIM and the MOU with the appropriate APL definitions that we felt needed to be called out in the guidelines that are mentioned throughout, and then each of these additional items here are sections from the MOU. And so when you get into the guideline, it does call out which section. And so you will see that we did not lift up every section that's in the MOU. If you feel like we do need to do that, please give us that feedback. So this is the overview right here. And again, this really just comes from the APL itself. And then we added a little bit more context around the purpose of this document and how it would assist you in your MOU. And then this is definitions. And so we lifted up any of the definitions that were part of the MOU, and then we added additional ones based on areas that we're calling out in the guidelines, such as ECM, CS, and maybe they're not necessarily called out in the MOU, but they are part of the guidelines here. One thing I want to call out is if you decide in your MOU that you are not going to keep the additional language of MDTs, though we hope that you will and see the benefit of keeping that, you could definitely change any of these definitions that you don't think apply to your local practice. All right, so I'm going to turn it now to the training and education. And in the MOU, we clearly state that the CDSS is going to assist in training the managed care plans on IHSS, and in particular the staff at the managed care plan that are going to be working in this realm. And so I know that CDSS has already provided a draft of what that training would look like. And so I was able to get that content and I added the additional items here that were called out in that training. And you could, if you decide that what CDSS is going to provide, you're going to provide more than that because your local procedures, your local practices are unique to your county. You could also add another item here to indicate the additional training that your county is looking to provide to the managed care plans in addition to what we added here. And then we do have a section here under training because it does talk about in the MOU that IHSS staff are also going to be trained on the benefits and covered services that the managed care plans provide. And so we kind of wrote a very broad statement, a generic statement about IHSS staff will be trained on those benefits by the managed care plan, either by the plan itself or by their designee. And I think in your negotiations, it's one of the things that you probably want to get more information about. What would this look like for your county with your particular managed care plan or plans? Because some counties have, 2+ plans. So I'm just going to take a moment to see if anyone has any questions. Okay, not seen any. I'm going to move on. And this again is section 6 of the MOU. So next is section 7 of the MOU, and this was a big piece of discussion in the MOU with the counties initially when we started to talk about the MOUs, and then when we did the work group of counties that came together to kind of look at what needed to be part of this guidelines. And so we tried to write this based on how it flows in the MOU. And so the first piece of the referrals are around referrals that your programs are going to receive from the managed care plans for Medi-Cal members who are currently not receiving IHSS. And we know that some counties were already receiving these referrals and monitoring them. The CCI counties already have a process for this, and then some counties this has already started. And so this is something that we put together to help that process around the information that you would possibly like to receive from the managed care plan and how you would like to receive it. And so if you have a unique process that you like to receive your referrals from your managed care plan, you would update that here in the guidelines so they know exactly how you would like to receive those referrals. And then the other big thing that came out of the conversations was, and this really kind of came out from the closed loop referral process, understanding what that meant for IHSS, also recognizing what feedback you give currently to any entity that is sending a referral on behalf of a potential applicant. And so we added language here around that in regards to that first referral type, which is coming from the managed care plan for a person who is not currently receiving IHSS. And so, we right away put the expectation that there is no expectation that a county would report back. Now, if you, through your conversations with your managed care plans, have decided that you will have a closed loop referral or a process to report back, then you can definitely update that here. And then we gave some additional guidance around the managed care plan could ask the member themselves for the notice of action to get information on that referral and the status of it. Or the managed care plan liaison could contact the IHSS liaison to get an update on individual referrals. And if you don't want that, you can definitely take that out of here. And then there is a section around dispute resolutions, which is at the bottom of these guidelines. And so for a lot of this, we just added a sentence around any disputes would follow the dispute resolution process. So I just want to give a minute if anyone has questions about this first phase of referrals that would come from the managed care plans for new applicants. Okay, I'm going to move on. Oh, and I forgot this last piece about if the member is denied IHSS services. So we added language there around that they would follow the normal process that is already in place. Nothing additional would be added to this. So the next referral potential that we looked at from the MOU was where it calls out that if a IHSS recipient, a Medi-Cal managed care plan member had a change of condition, it talks about in the MOU that the managed care plan would maybe notify the IHSS program. And so we lifted this up as a potential referral or information sharing. And one of the things that we learned from several of the counties is that it wasn't just a change of condition that needed to be reported. It was a change of condition that would impact functionality, and that being clear on what that actually means so that not every time there's a change of condition, IHSS is notified. And so under B, you'll see all the language that we added there around that and information to be included from the managed care plan about why is this something that needs to be reported to IHSS. And then we did also add a release of information if it was something that where you didn't have this relationship already, it wasn't part of the original intake, and now a release of information might be needed. We also added language here around there was a concern that if the managed care plans were going to share a change of condition, that there was a concern that there would be an expectation from the managed care plans that IHSS would do something about it. And we put language in here that clearly stated that they would act upon it based on the requirements that IHSS has. It's not that the managed care plan sends this over and there is an obligation to act on it. It's to be reviewed at the local level and at the IHSS program that they make those determinations of what they're going to do with that. So I just want to give a moment to see if anyone has questions about this particular area.
Hey, Beljeet, it's Jeanette. I don't have a question, but just a comment and just to thank you for adding that information that you just stated about the change of condition, because in some of our conversations, it seemed as if maybe the health plans think that we will do a complete reassessment, and that is not the case. And we have a criteria, the counties have a criteria to follow. I do know that another county I was speaking with said they have seen an increase in these requests. And so this is a real key a piece that you added. So thank you. That's all I wanted to say. Thank you for putting that out there.
Great, thank you. And it's feedback coming from the counties that we needed to, it wasn't just a change of condition, but how it impacts functionality. So appreciate that, Jeanette. Tara, I see your hand up.
Yes, thank you, Tara from Napa County. I am wondering, Baljeet, I've got the template that was worked on and provided, and I'm wondering, are all of these changes captured in the template with the recommended language, or should I be going back using the template and sort of cross-referencing it with this document now? Because it sounds like there's been some additions and nuances, and so I'm just trying to sort out the best way to utilize these two documents.
So are you talking about the MOU document?
I'm talking about the MOU template that was developed.
Yeah, so this is in alignment with that MOU document, and we've there was a lot of conversations from the managed care plans about not adding not getting into the weeds basically in that MOU and kind of creating a separate document that would be the operational guidelines, the policies and procedures. So where you may not see, and I want to say that we did add functionality into the MOU. This kind of takes it a step further of what do we mean when we say that the managed care plan is going to refer for a change of condition around functionality. It kind of looks at it more further. What does that actually look like? Does that help?
Yes, thank you.
And if there's anything in here that you want more conversation around, you can definitely email me, Sharon, the CFPIC team, and we can set up a call where I can go through it in even more detail. All right, so I'm going to go to the next. So those are the two categories of referrals that we kind of looked at based on the MOU and based on the conversations with counties that would come from the managed care plan. So now the next is referrals that you as IHSS programs and your staff may refer to the managed care plan. And there was quite a bit of conversation around this as well, like what would this actually look like? And one of the things that we heard a lot was that staff don't necessarily have the time to complete referral forms for ECM or CS or the other managed care plan covered services. And so we wrote this up with that in mind. And so more it was around that your staff may provide a flyer to the recipient or the potential recipient, and which would come from the managed care plan, and that would be provided to the recipient. Now, maybe in some of your counties, you're going to take a more active approach and you could add additional steps to this section if you're going to go beyond just providing a flyer. And so that's what this section is about. So I'm just going to give a moment for folks to look at this and see if there's any questions around this. All right, not seeing any questions. I'm going to move on to section 8. So section 8 is a big section of the MOU, and there was definitely a lot of conversation around what do you mean? What is care coordination? What kind of collaboration are we talking about? And so this is where we really lift up the MDT approach here, and we've added language here around that. What does it mean? Now, we fully recognize that MDTs maybe are not being called by IHSS, and maybe IHSS is being asked to join an MDT that is being called by your counterparts on the APS side. And we felt that this was a good opportunity to include the managed care plans in this process as well. And so we've added the language here around, what it is, how to get it facilitated. And you may decide to add some additional language here based on your local policy and practice around how MDTs on the adult and aging, APS, IHSS are called together for all parties when you're working with an IHSS member that has a number of complex needs that are not only IHSS related, but maybe now they also have an APS referral, and maybe keeping them at home is somewhat of a struggle now. And so asking the MCP to be part of that conversation, being part of that staffing, teaming, to really come up with the best plan. And so we felt like the MDT would be the best approach to that. You may call it something else, and so you could definitely change the language around this for that. Okay, and I just see the comment in here from Shannon, so I appreciate that, Shannon, about change of condition. Yeah. So just want to give a moment if anyone has questions, comments about care condition and the MDT that we added here under A. Okay. Now, one of the things that we did hear from our managed care plan that reviewed this was to really allow for the virtual option for MDTs, especially with managed care plans that are in multiple counties. And so, if you're a Kaiser County, a Partnership Health County, Anthem HealthNet, they kind of have a larger scale operation in multiple counties, making it available in a hybrid or virtual environment may make it more easier for them to want to do this. B is care coordination with ECM and CS providers, driven by local policy and practice. And so kind of put some steps in here if they have been referred for ECM or CS service, that you may have these providers reaching out to the IHSS program to get coordination, collaboration. If you guys could really look at this and see if there was anything that we missed here that would need to be included. Again, you can definitely change this based on local policy and practice. I think one of the biggest concerns that we heard from counties was IHSS social workers with their high caseloads are really just out in the field doing those initial assessments or those annual reassessments, or maybe they're going out because of the change of condition and doing another reassessment. There was concern around how would that care coordination actually happen. And so would it be those IHSS county positions that are called out in the MOU? Would that person do that? Would it be somebody else? And so this really needs more local policy and practice to be included here for your particular county. Okay, just giving a moment for this. All right, so I'm going to move on to C here, which is care coordination with the managed care plan. And some limited information here, but I think the biggest thing to call out here is when an IHSS recipient is admitted into the hospital or a facility, that then prompts that transitional care services, which is a managed care plan responsibility. What is that care coordination going to look like with the IHSS program? And so we've put some language here around that, where we really kind of added the language around this is an opportunity for an MDT meeting to be called, and that the MCP can definitely call for that if appropriate, documentation and CMIPs. And then if there's additional steps that need to be taken around this. I think I do see it. I thought I saw a comment. No. And there might be other examples, maybe that you're already seeing where the managed care plans are kind of reaching out to do some care coordination. And if you are seeing that, please share those examples with us so that we can kind of re-look at this and make sure that we captured everything that needed to be here, kind of focused on the transitional care services. But there might be other stuff that you're coordinating with the managed care plan that I'm not aware of. So the other piece that we put in here, and this is care coordination when a recipient moves to another location. And kind of, you know, the expectations here, and we really wanted to call out the continuity of care when a recipient moves to another location. And when I say location, I'm really talking about another county, because if they move to another county, it impacts their Medi-Cal, where they may then have to they may get disenrolled in their current plan and move to another plan. And so continuity of care may kick in for some of our members who have specialized providers and services. And so we wanted to call that out. And then we also added some language around some of the IHSS responsibilities around this as well. And so if any of you have already kind of been starting to deal with this with some of your IHSS recipients, if there's anything else that you think we need to add to this section, that would help us as well. And if you also need us to add some additional language in the guideline around what does continuity of care mean for the IHSS population, we can definitely do that. Now looking at it, I can't remember if we added that as one of the definitions, continuity of care. So I'm going to make a mental note that I need to go back and look at that. All right. So I think the last area under care coordination is when IHSS recipient as a facility admission or stay, kind of mimics a little bit of around section B, C, but goes into a little bit more detail. Again, the transitional care services, and then if they're enrolled and participating in ECM, whose responsibility transitional care services become. Usually it's that ECM provider, and so they may reach out, if not the managed care plan. And then this is where it's also, again, it could prompt the managed care plan notifying the program if there was a change in functionality, or if that transition to a facility, to another facility instead of going home. And so we've put some language here around that and some of the responsibilities there. And again, if we've missed some of the steps, please let us know. If it's a step that you have locally, we'd love to hear about it, but we may not necessarily add it to the statewide guidelines, but it would be good information for us. All right, going to move on to section 9. So section 9 and 10 are around these quarterly meetings, and then I think section 10 is around those quarterly QI activities. So in the MOU, it clearly calls out that IHSS and the managed care plans are going to meet on a quarterly basis. And so we added it to the guidelines of, what that's going to look like. And not a lot of additional information went into this beyond what's already in the MOU. But really making one of the things that we heard from former CCI counties and current CCI counties was they've had these meetings, and sometimes these meetings went on for hours and hours because they were working on individual case level, trying to resolve individual case level details. And that's not the intent of this meeting. It's more large scale, systemic issues and things like that. And then it's also a place to kind of monitor the QI activities and quality improvement that the managed care plan is helping IHSS with, and vice versa, where it's appropriate. So, and again, based on your negotiations and how you come to decisions around this with your managed care plans, this can be updated based on local practice and policy. So the next section is quality improvement. This is called out in the MOU of things that you're going to work together. And so we added all of this here. Also recognizing that one of the things that a lot of counties kind of brought to our attention is that you have your annual reviews that are conducted by the QA at CDSS. And so are you really looking to do additional stuff beyond that? And so, you can add additional language here that your QI activities will mirror what your quality improvement audits with the state are. And so you can add some of that language. But we gave some sample QI activities here as well that you could adopt if you choose, and you would update this based on what you both agree to ultimately through the MOU execution. And that this would probably then get updated based on year after year what you're finding that you really want to work with your managed care plan. So, I think as a managed care plan, if I was in the managed care plan, one of the things that I would want to really look at is utilization rates of ECM and CS within the IHSS population. So we kind of called that out. You may want to go further and look at not only how many are referred, but how many get into the program, what kind of health outcomes you see from that enrollment. Do you see the benefits of utilizing ECM and CS for your population? We call out training. Maybe you want the MCP to help you with provider recruitment. And so these are some of the sample QI activities that we put on here. Now, the managed care plan may have their list of QI activities as well that they would like to be part of this, and so it's a conversation, it's a negotiation between the two of you. All right, so I'm going to move on to section 11. We only have 2 more sections to go. So this is data sharing and confidentiality. There was a lot of concern around this area in regards to, what information the managed care plan wants. Does the IHSS program have the authority to share that information? And so based on CDS guidance and how we added additional language to the MOU, we do call out the release of information in this section. And I know in some of the CCI counties, they kind of already have a process. And so you may want to add some of that additional language here. And it is something that CWDA continues to explore with CDSS and DHCS on how can we set up data exchange that then doesn't get placed on the counties, that it's kind of a data exchange at the state level. How much can come from CMIPS and then provided to DHCS, who would then provide it to the managed care plan. So this is a work in progress, this section, but based on what we know now, that's what we added here. All right, so I'm going to go to the last section. So it calls out dispute resolution, and this is when the managed care plan and IHSS cannot seem to resolve an issue. And I've asked of examples of where this may happen, and we kind of call it out in this guidelines. We kind of put a sentence at the end of any section where we feel that there might be an issue where it can't be resolved, and that you would follow this process here. These emails are emails that were provided by your state partners, and so these are the correct emails. If there is a dispute, that needs to be taken up to the state. So I'm going to stop sharing, open it up. It was a quick overview, and see if anyone has questions, comments, feedback. If you found a spelling error, grammatical error, please let us know. We want to make sure that this is the most cleaned up version of it. Anything that you feel that we missed from the MOU that you think we should add? Thanks, Jeanette. And do you feel that this will help you as you continue your conversations with the managed care plans? Do you think this will help you kind of really visualize and conceptualize how this will look in operations, so that your staff will better understand what this MOU means on that ground floor staff level? Not just staff, but frontline supervisors too. I see some folks that I've had one-on-one conversations, and that was one of the things that kept getting lifted up is, okay, we're going to execute the MOU, then what? So does this help you with the then what? Oh, I see you, Deborah, but you're on mute.
Okay, Baljeet, I did appreciate it. I did learn, and I'm a little more open to the IHSS MAU and putting in some time. Thank you.
Thank you, Deborah. And I think it may help the managed care plans better understand where the counties are coming from. Well, that's the whole guideline. I didn't have anything else prepared. We can let you go, or we can take a couple of moments to talk about what else does IHSS need in this realm. We've dedicated the adult side of CFPIC to kind of get into this space. What else do you need from us? So that we can continue to support and help you understand CalAIM, understanding this MOU, but also, we want to see more utilization and referrals going to ECM and CS with the adult and aging population. And many of you not only oversee IHSS, you're also seeing APS, maybe even the PGPC side of things. What else can we help you with to kind of better understand how the managed care plan can be another system entity to help you get those services and resources that your clients need?
It's a Friday. People are tired. And at noon. Hopefully no one has a sugar low.
Well, just as a follow-up, the information from today's meeting and the recording will be on our CFPIC webpage, specifically located on the adult side. And so if you would like to come back and review that, feel free. If you need an emailed copy of the document that we provided, please feel free to let us know and we'll get that out to you. Let's see. Oh. Okay, if that's it, I would like to thank Baljeet and our CFPIC team. Thank you for everyone who was able to attend. And we will get the information out for our next brown bag as soon as we get it all put together. Have a good day, everybody. Happy weekend.
Thank you.